Hello, welcome to 2018. It's snowing outside, or at least it was snowing a little bit earlier. I hope everybody is inside and warm and safe from the ice and avoids accidents. I was out a little bit earlier shoveling my driveway. But every video, if you're watching these in chronological order, every video from this point on will take place in the year 2018 and beyond. So keep that in mind as we look at these. We try to always make sure that the videos that we shoot do not go that they stay relevant, and that if there's anything that kind of goes into a law that may have changed over the past year, we try to get rid of that video or update it. But if you're watching these in order, from this point forward, these are going to be videos for the year beginning 2018. So let's start off with our first question. We got a number of them over the annual enrollment period, and I'm going to try to bring them to you over the next couple of months. First one: what is preventative dental? What is comprehensive dental? And what does Medicare cover? Alright, so I'm going to take the last part of that question first because it's going to be relevant for the rest of it. So Medicare says specifically what they won't cover, but not what they will cover. And really what they say that they won't cover are the things you think about that you want Medicare to cover. So, when you think you want your teeth cleaned, you want a filling, you want an extraction, you want dentures, you want x-rays, you want fluoride treatments, all of that, no. Medicare does not do it at all. They're pretty specific about it. What have I seen Medicare covered? I had a client about 10 years ago took a spill off his motorcycle. Medicare reconstructed his face, and when they reconstructed his jaw and teeth, Medicare covered that. Had another client about 6 or 7 years ago, had some chemotherapy, some radiology that went bad, and Medicare did cover, again, the reconstruction of the lower part of his face and prosthesis as a result of it. Medicare did cover that as well. Those are extremely extreme and extremely rare. But that is about what I know of Medicare covering for dental. The stuff that people think about for dental is not there. Why that's important to you and why I mention that first is because if you have a Medicare supplement, a traditional Medicare supplements cover the remainder of the bill that Medicare approves. But because Medicare does not approve dental insurance, or does not approve dental coverage for the most part, the supplement does not either. So unless there's some sort of addition onto the Medicare supplement, your Medicare supplement will not give you dental coverage. So it's going to be a separate issue. Now, Medicare Advantage and even employer coverage may cover some dental, but dental is broken up into, as the person who asked this question, preventative and comprehensive. There are different levels of comprehensive as well. We'll get to that in a second. But what are these defined as? So preventative dental is the stuff that you would see a dentist for every year for the maintenance of your teeth. So if you are going in for a cleaning, a checkup, once a year some x-rays, if you are going to get a fluoride treatment, a polishing, all of that is considered preventative dental. Now, then there's comprehensive dental. Comprehensive dental would include extractions, fillings, that root canal, gum surgery, treatment for periodontal disease, dentures. That is comprehensive, and there's different. Oh, and orthodontia. all that is also a different level. Comprehensive dental is broken up into different levels typically. There's basic comprehensive, there's major comprehensive. Lately there's been that third level, which has been orthodontia. Orthodontia has been, that's braces. And that's traditionally been, in TMJ, that's traditionally been in the venue of children, where it was covered by insurance, or anyone up to age 16. The last 3 to 5 years, though, I've started seeing a lot more adults and retirees be able to access that benefit as well. So it seems to be redefining what level 3 comprehensive dental is, or orthodontia is, and its relationship to comprehensive dental. So it seems to be coming in. But for the most part, orthodontia is its own level. Minor services and major services, or basic services and major services, come under comprehensive. Now that is typically covered by supplemental dental. Now, that is different from preventative, which sometimes, and this is actually where it came up in context of how it came to my attention as a question this year, preventative dental is sometimes offered at no additional cost on a Medicare Advantage plan. It can also be offered at no additional cost on major medical. It can be offered at no additional cost on employer coverage. They don't stick around too often, but every now and then I see it show up on a Medicare supplement as well, but I don't see it there for many years. But you can even see preventative dental on a Medicare supplement. Again, generally there's no additional charge, or there's a very, very, very small token charge that goes along with preventative dental to find it on these plans. What's important to you is to see, is this what you want your dental insurance to do? If all you need is dental insurance to cover your 2 cleanings a year, your 1 x-ray a year, and your polishing, all you want and need is preventative. The stuff they throw in for free on Medicare Advantage is most likely going to be suitable for you. However, I would also argue that you should not make an insurance decision based on preventative dental benefits if all you need, if the only thing you are concerned about with dental is the preventative services. If, however, you need comprehensive dental, that's a different story. The first thing you need to do is, if you're looking at dental coverage that is being offered on, say, a Medicare Advantage plan, take a look and find out, is it comprehensive? A lot of times, it says it in the summary of benefits, and a lot of times it's going to say either the very first line is going to be preventative coverage only, or the very last line will be comprehensive not included, or comprehensive included at an additional charge. So it's important to take a look and see, what are they doing with that? Are they going to be actually giving you comprehensive dental? Is that what you want? Are you actually looking at purchasing, making the decision to have that insurance because of your expectation of what comprehensive is? So that's the first thing. If it's not there, give it a second look. Now, the next question is, should you add it, or should you purchase it as its own standalone product if it is not being offered to you as something extra? And like I say, comprehensive, most likely it's going to be a separate purchase. I haven't seen too many non-Medicaid plans offering comprehensive dental going into the 2018 year. Is it something that you need? Well, there's a few considerations to have. The first question you need to have is there a waiting period to use the comprehensive services, and how long and can you wait? Preventative typically doesn't have one. Or if they do, it's a very short one. It's reduced, but typically there's none. In other words, you'll be, if you buy it on a Monday, on a Tuesday, you'll be able to use it to get your teeth cleaning. It's usually not a big deal. However, if you're looking at buying insurance because your dentist told you that you're going to need a root canal, A lot of times the dental insurance is going to make you wait 6 months to a year before you can access that particular benefit. There's nothing shady about that. The reason why insurance companies do that is because a lot of times you don't look at dental insurance, or you're going to give dental insurance a pass because you didn't want to pay the premium, or for whatever reason you didn't want it. Then the dentist told you you're going to need it. Well, now you're going to look for it. The thing is, you're going to get the insurance, use the insurance, and then typically the insurance company is going to expect you to cancel the insurance shortly after you get it, not keep it for those times you're healthy. An insurance company can't keep going and paying claims when something like that comes up. So what you need to do is get the insurance before you need it and hang on to it, so that if at some point in the future you do need it, the insurance is going to be there. So that waiting period is actually there for a reason. If it turns out that you need dental coverage, this comprehensive coverage, you need it to be in place and those waiting periods to have expired before you use it. So that's the first thing to be aware of. The second thing is comprehensive dental is typically not like a Medicare supplement where it's going to pay 100% of the bill. Comprehensive dental is going to typically have a deductible, then make you pay some cost sharing. Cost sharing means you could pay 20% or you could pay 50% of that bill up to after a certain deductible, or after a certain amount of time has passed. And then after that, the insurance is typically going to have a maximum amount that they will pay, not what you will pay, a maximum they will pay. This year, the plans that I'm offering typically go up to $1,500 or $2,000. There's a couple that go higher, there's a couple that go lower, but typically $1,500 to $2,000. And what that means is if you are staring at the face of a dental procedure that you need, that's going to cost up to $2,000. You are going to have a waiting period before you can use it, or if you've met it, then you don't need to worry about that already. Then you're going to have a deductible that's going to need to be met, and then whatever the final bill is, the insurance is only going to pay 50 or 80% of that bill up to the amount of money that you purchased for that year. So these are considerations that you've got for dental insurance. And this is comprehensive dental. And this is typically why when I give you all these things, when I say, look, you've got to pay this much money, you've got to wait this much amount of time, you've got to have a deductible, there's a maximum that they're going to pay, but insurance is being placed in front of you that says it's not going to cost you anything and you're going to be able to use it immediately. Well, that should clue you in that this may not be comprehensive, that this may be just preventative. And why this is important to you is because if you need to actually use this insurance, and you're getting this insurance because this was that one thing that pushed you over the line. You're looking at 3 or 4 different plans, and that's the one you chose because it had this great dental benefit. Take a close look at that summary of benefits and see, is it actually preventative only, or is that comprehensive that's included? Now, I just gave you the format for one type of dental insurance. It's actually the most common type of dental insurance around. There's also some other kinds. I've got a dental HMO plan that actually has no waiting period at all. It has actually the schedule. You will pay this set amount of money for these types of procedures. It actually kind of violates the rules to that. The problem is it's also very highly networked, so you would have to go to a specific place to get things done. So what I just told you is not all-inclusive. It's not comprehensive. There are exceptions to it. However, the majority of plans that are available to you do have those terms to them. There's the waiting period, deductible, cost sharing, and then the maximum amount that they will pay in a year for you for comprehensive. And it does change based on, is it a basic service, is it a major service, or is it this new level 3 service with for orthodontia and TMJ. So that's generally where that stands. In terms of the satisfaction level of dental, the satisfaction level is quite high for my clients that have dental service or dental insurance when they know what it is they've purchased. In other words, what that means is there's very few surprises. If our clients know that they're going to have this waiting period, they're going to have to pay this much in premium, they're going to have to pay this much as cost sharing because the insurance isn't going to pay 100% of it, and they know all this when they purchase the insurance, they're actually very likely to keep the insurance. They're likely going to be pretty happy. However, the satisfaction rate with our clients is actually fairly low if they get any kind of surprises. So if you took your Medicare Advantage plan because it had dental, but then found out what they cover is the teeth cleaning and what you need is a filling because you got a cavity and it won't do it, your satisfaction level is not going to be that high. And kind of one of the most important things with health insurance, the most important thing is to make sure it's going to do what it says it's going to do. But the next important thing, the second most important thing, is to make sure that your expectations match what the insurance is. And I mean, that's kind of one of the things. Remember, we're brokers. We work for our clients. We don't work for the insurance company. So if you are going to hire us, we have to make sure that you understand that this dental insurance is going to do this, and it's very important that you understand, look, preventative service, comprehensive service, if all you want is just your teeth cleaning and everything, it's going to cost you this much or possibly nothing at all. But if you need this done, if there's going to be some dental services that you need done, it's going to come under this particular level, and this particular level is going to cost you this much money, and there's going to be this kind of waiting periods and other exclusions that go along with it. So it's important that you know what goes on with these plans when you get it. The worst thing that can happen is you get insurance and you tell us that you expected A, B, and C when really it does D, E, and F. So it's very important we do that. And I guess my biggest takeaway from this, the one thing I want you to know, if nothing else, is dental insurance is dental insurance. Medical insurance is medical insurance. Even though dental may be included at some level under some of your dental services, we really want to make sure that when you buy your medical insurance, it's because you know that your medical is there to make you get better, to save your life if something happens. Dental insurance, teeth maintenance, dental hygiene, very important. That is a different level than medical. So I just don't want you to forget that perspective. That dental insurance, while important, we want to make sure that first and foremost you have coverage for if you come down with cancer and have your heart attack. That is number one. That is number one priority for us. We have to make sure that your health needs are taken care of if an emergency arises first.